Hello, I'm Greg Benevent, and once again, I'm joining you for another Website Depot podcast. Today, I'm very happy to be down here at the Venice Beach Surgical Center, and I'm here with a truly great doctor, Dr. Augusto Rojas. It's nice to meet you. How you doing?
Nice to meet you too.
All right, so this is a lovely practice. I've been sitting here for a minute now. This is truly great. I'd love to ask you, how did all this get started? How did you, get into all this? Where did you come from? A bit of your background, that kind of thing, doctor.
Well, I come from a family of lots of doctors.
Lots of doctors. How many doctors is lots of doctors?
My grandfather, who was born back in the 1800s, was the first dentist. Then his brother was a dentist.
Wow.
Then his one of his daughters became the first Colombian female doctor, or if not the first, the very few.
That's incredible.
First women doctors. That's back in the 1950s in Colombia.
Wow, so that's an entirely different world.
And besides, women couldn't even vote back then.
Jeez, that's right. No, you're right. Yeah.
So she became an internal doctor, and she moved to internist, and she moved to Guatemala.
Okay.
Met a cardiologist, married the cardiologist, and now they have like 6 years of married to doctors.
Wow.
So we have a legacy in Guatemala.
I can tell. I was trying to follow that. How many doctors to add them all up as you were going? There's family doctors, married doctors, and add more doctors.
Yeah. So we are originally from Colombia.
Okay.
My aunts moved back to LA, New York, and LA back in the 1940, 48, 50.
Wow.
And so we are actually one of the first Colombian families in California. I have lots of nephews.
Okay.
We are like 48 total in the number of members in the family.
That's a big family.
And
yes,
we have, I believe, 6 or 7 doctors in the family already.
Wow.
So I, following my brother, my oldest brother, legacy or interest.
Certainly.
He was a plastic surgeon.
Okay.
I decided to become also a doctor. So I became a doctor. I studied in medicine in Colombia, in Bogota, Colombia, in the mid 1970s to mid 1980s. I came back to Los Angeles and did a residency in surgery at Cedars-Sinai Medical Center in Beverly Hills.
That's pretty amazing.
I practiced for a while. When my brother was ready to retire, I began becoming a cosmetic surgeon.
Oh, okay.
And so I've been practicing cosmetic surgery for about 20-something years, like 23, 24 years.
Okay.
And initially with my brother, and then he retired, and he came back. And, But so here we are. I've been practicing cosmetic surgery for about 24 years. Wow. And I specialize basically mostly in liposuction.
Okay.
About augmentation with fat.
Okay.
Breast augmentation.
Sure.
And my brother still helps me in some of the cases.
Oh, I mean, it seems like the family doesn't get away from being doctors. I mean, that's sort of the thing that goes around. Yeah.
So he still practices with me tongue tags and breast augmentations and things like that.
Okay.
So that's where we are. We've been here in this location, which is near Venice Beach, near Beverly Hills, near the airport. We've been here for about 30 years.
Wow. Okay, I mean, it's still, I would not have guessed that having come down here. I thought this was much, much newer than that. I mean, this is extraordinary, like you said, just being right so centrally located between the ocean and the airport and Beverly Hills and all of that. This is what a great location this is.
Yes, I think so. We're also close to Playa Vista, which is the Silicon Beach of California. So it's really
Yes, it is. Speaking of Silicon Beach and that kind of thing, I heard you mention throughout that about, how you made that transition to being a cosmetic surgeon. And I was sort of wondering if you could explain to us what maybe the difference is between a cosmetic surgeon and a plastic surgeon, because I think for a lot of folks, they see them as synonymous.
Yes, well, In my case, medicine, as we know it, began to lose the appeal of money. The doctors are not being reimbursed for their work as much as they used to, and the new coming of the managed medicine.
Okay.
And the PPOs, the HMOs, and all that became very difficult to practice.
Oh, I bet.
And not very lucrative.
Mm.
So I decided to follow my brother's steps and look for something that I always loved, which is women and how they look.
Okay.
And so I knew that there was a lot of money to be made in aesthetics and in surgery. Mm-hmm. But not only that, it's also has always been my passion.
Uh-huh.
And ever since I was a small boy, I wanted to be either an eye surgeon or a plastic surgeon.
Okay.
Only that things didn't work out that well when I came back to get a plastic surgery residency.
Uh-huh.
But so I had the opportunity to become a cosmetic surgeon.
Yeah.
Now, what's the difference between cosmetic surgery and plastic surgery?
Sure.
Plastic surgery generally refers to reconstruction. Somebody who is doing reconstructive surgery, who is, for example, specializes in correcting congenital defects. Also, somebody who is traumatic surgery, for example, the person who's into a car accident. His face is all messed up because of the accident, and then you have the guy who does reconstruction.
Right. Okay.
Cosmetic surgery refers more is a field in which you try to hide, to camouflage the defects. And somehow increase or make it more apparent your good qualities.
Right. Accentuate what's best about you.
It's like cosmetics do. For example, you have
the makeup,
a lip. You put a color.
Yeah, lipstick.
A lipstick. You enhance the color of the lips, make them red or whatever, to make it prettier or make them bigger. You put more eye. You use the eye color to change the color of your eyeshadow or your hair, for example, because you don't want people to see your gray hair.
Right.
So you are camouflaging, hiding your defects, and you are enhancing your attributes. That's basically what cosmetic surgery does. Now, of course, plastic surgeons can do that too.
Right. Yeah.
So plastic surgeons may have experience on doing a lot of these things, but cosmetic surgeons are as good as anything, depending on not only your knowledge, because knowledge can be achieved by everybody.
Certainly.
But the quality of your work. The quality of your work is a different story. Yeah. Because it depends on how well of a sculptor you are, how an artist you are.
It's as much science as art, what you're trying to do. Yeah.
Yeah, I mean, cosmetic surgery to change or to enhance or to improve somebody's image. Yeah. You need to have some artistic
100%.
Elements in it. And you have to know what women like. You have to know what is good, what is not good. And you have to know how to improve every little thing, so to make that woman what she desires to be. Even if it's not natural, because once you change something, it's not natural anymore.
Right.
But the idea is that a good cosmetic surgeon will make unnatural things be natural.
Right.
And
that's good.
And the person who is the lucky one to have that change, to be happier, to have more self-confidence.
Certainly.
To feel better all over, to wear clothes that she wants to wear.
Absolutely.
So it's a big thing. It's a big thing because it not only affects the person physically, but affects the person mentally.
100%. Mentally, emotionally, all of that. Yeah.
So that's the difference between cosmetic surgery and a plastic surgery.
That is just fascinating to hear you say that, because I'm just thinking about, the plastic surgeon is to almost to, for lack of a better word, to fix something that's fallen out that's maybe not what it was, whereas the cosmetic surgeon is to improve beyond, to make even better, to add in some new thing. And I was very struck by a whole lot of the different things you were saying there, but particularly about how it was, you mentioned about being the cosmetic surgeon as sculptor, and that ultimately you're going to be judged by both your eye and what you can achieve and what you can do. And as I'm going through, as I've been entering your center here, I can't help but be struck by all the different diplomas and awards and such that you have hanging on the wall. And people have even told me, working for you, they're like, this is what the doctor's done, but he's continuing to educate himself as well. If you could tell us a little bit about, you mentioned obviously Cedar Sinai and going to school before, but maybe you tell us a little bit about some of your other qualifications as well. Not that what you didn't say was a lot of qualifications in that with the eye and knowing what beautiful women look like, but yeah. And,
actually, just before the year 2000, I went to Mexico City.
Okay.
Mexico City, to Mexico, to the country, and I studied cosmetic surgery at the University of Morelos in Cuernavaca.
Okay.
They were offering a curriculum for cosmetic surgery which was not available here in the United States.
Oh, okay.
And some of these cosmetic surgery or these plastic surgery courses in the United States back then were offered only to plastic surgeons.
Okay.
So I went to University of Morelos and I learned for about 2 years. I went continuously to learn about cosmetic surgery. So I have diplomas from the University of Morelos, and then every year we go 2 or 3 times to different congress or seminars.
Okay.
To enhance your knowledge.
Always helpful.
And what I always say is that sometimes going to seminars and doctors' meetings, it's not only to learn a new thing, because you can also read about it.
Right,
or you
from
can
your
go on
desk.
YouTube but sometimes it's important to know what you should not do. And I think that is even more important. What you should avoid.
Yes.
The complications, how to fix complications, how to do all things. It's more important than knowing anything, because you are doing it yourself constantly.
Right.
Every day.
Yeah.
So you know how you do it. But what other people find that is helpful for your practice. Also, it's important to have access to technology.
Certainly.
Technology has changed the game in plastic surgery.
I bet.
You need to have that artistic component.
Oh, I bet.
That is only yours. So that they say it's not the arrow, it's the Indian. So this is something like that, because you can have all these devices, but if you don't have what it takes in your mind to change something, you don't know how to do it, or you don't have the right image, then it's not gonna work.
The sculptor, the artist's eye, like you mentioned earlier.
So that's, I think, it's very important. So I've been all over the world, in Canada, Europe, South America, the United States, and I have also been speaker at some of these seminars.
It's not a surprise,
So I think, I think as any doctor needs to be updating.
Okay.
It's unbelievable that we know about hypertension, but every time you go to a hypertension seminar, you learn something new.
Oh, I bet.
And even though it's such a small topic, but it's important to update your knowledge and your techniques, and to see what's out there in devices that can help your practice.
Certainly, no, that makes all the sense in the world. I mean, to continually improve, and like you said, technology has altered so much of this industry, and yet in the end, it's always going to come down on some level to that artist eye, the artisan skills, all that. On that same topic, you mentioned other doctors. I mean, if someone is in the position of researching a cosmetic surgeon and someone to work with, what are some steps or some things they should keep in mind if they're trying to find the right doctor for them?
Well, if a person is interested in doing a cosmetic or a plastic surgery procedure, and she should also first research the procedure.
Okay. Yeah.
Okay, it's a BBL. What's a BBL?
Mm-hmm.
What is it? That information is there for everybody, not just for doctors.
Right. Oh, yeah. Mm-hmm.
So then what's entitled? So you learn about that. The more you learn about your problem, the better you're going to understand the doctor. The better you're going to be. The better you're going to be prepared for the surgery and for the results of the surgery. So that's the first thing that you should do.
Makes a lot of sense.
The second thing is look for a doctor.
Okay.
Now, how do you look for a doctor? You can do some research online.
Certainly.
But the best way is to do it by asking friends, people who you know who have had surgery.
Okay.
Who they recommend and why. You see somebody who apparently overnight changed her appearance and now she comes with boobs and a new butt.
Right,
and
exactly.
She looks great and she looks beautiful.
Perhaps she didn't just get that at the gym, yeah. Mm-hmm.
Ask her, yeah. So how do you get that? I mean, did you do that in 1 week? I doubt it. So ask that.
Uh-huh.
Once you find the name of the doctor or doctors, you should research them online.
Okay.
Go to Google them, and find out if they have a license, if they don't have a license. Check on Yelp, maybe. Don't believe Yelp too much or Google, because they give a review, they give a point, or they take a point. Sometimes it's unrelated to what the doctor did.
Oh yeah, it could be anything.
It could be because the receptionist did not treat the patient well.
Or they were out, the water was warm, or the parking was bad. I mean, something goofy.
She was late 10 minutes and the doctor was upset, or something that has nothing to do with the surgery.
Right. The exact opposite of all the things we've been discussing so far.
So you should read the comments.
Yeah, hey.
If you read the comments, you see that there are 10 comments that are saying, I hate this doctor, I don't like the results, don't do it. But if you see the doctor that says 10 results, I like him, he's great, my results were great, I'm very happy. And then you see a comment that, the surgery hurt a little bit, or I wasn't able to sleep that night. Something like that has nothing to do with it. Disregard those and just focus on the things that have to do with the doctor and the procedure and the results.
Right, the things that you can control as the patient when you're researching.
Because Google, these technology companies, they're not people. Their comments are there and they don't understand them. It's a machine that is choosing to put the star or not.
That's exactly right.
But you don't even know who the doctor is. So I think that's very important.
Oh, 100% is.
Yeah. And once you know that you like the doctor online, he has Instagram, he has pictures and all that, and you are convinced that he might be the one, give a call and make an appointment. Yeah. See what they have to do. Also, you have to, once you try to go in person to the visit, because it's different when you're talking on the phone. Nobody sees anybody. You don't understand. I mean, it's just a voice. Yeah. You come in, you can see is the office clean? Is the office comfortable? Are the patients, are the employees nice to you? Did they treat you well? Is it difficult? Is it how is the doctor? How the doctor manners? What kind of information they gave you? All these things that will give you the sense of what the doctor is. If you see and you go in and you see an organized office, clean, well, that's how your surgery is going to be.
Makes sense.
If it's a mess, everything is a mess, and your surgery is probably going to be a mess.
Right, exactly. The machines probably weren't lying to you then. If it's a mess around the office, yes.
So go in person.
Mm-hmm.
Talk to the doctor. Ask questions.
Okay.
Now, if you're looking for the lowest price,
okay,
you might not get the best results.
That makes sense. That seems like a common sense kind of thing, doctor.
What is it? Things that are cheap, they turn out to be more expensive.
Oh, yes, ultimately, especially when it's your body. You know, as we're talking about, you're trying to change who you are.
You don't rely too much on the price, because it's important, but the important thing is your results.
Yes.
Now, of course, if you don't want to pay, there are doctors that are extremely expensive. There are doctors that are extremely cheap. Just because you're extremely expensive doesn't mean that you are good or that you are better than the one.
There's a different price. Okay.
It's a different price, but so do the same thing. Just treat the same the doctor that is in the expensive place in Beverly Hills or a very expensive place. Do the same. Do the research. Do everything.
Yeah.
Because just because he's in Beverly Hills doesn't mean he's good.
Yeah, it could just be you got the land. You don't know the circumstances behind it, which is why you have to do the research so you're informed for you.
So if you're looking for the cheapest, just think about it. There is a difference between going to Nordstrom than going to Target. So if you want to look for a Target doctor, there are plenty out there.
Right? Oh, yeah.
If you're looking for a Nordstrom, there are some there. So there is something that is called the happy medium.
Okay.
The happy medium is somebody who is in the right price. It's in the middle.
Okay.
And somebody who is not that expensive, who is not that cheap, who probably have better results, good results.
Yeah.
Do the research. You don't have to pay top money for some of these surgeries, because some of these doctors just Beverly Hills doesn't mean that they are the best.
Right.
But they are the most expensive. So look for someone in the middle. That's the happy medium. And happy medium is really the best in almost anything.
Makes sense.
So once you find the happy medium, and you're content, happy with the price, and you're comfortable with the doctor, find out where the surgery is going to be done.
Okay.
Because
it is. Yeah, that makes sense.
It's very important that the surgery doctor who is going to operate on you is going to operate in a surgical center that is accredited and is authorized by the government.
Yes.
And you can check that online. You can go on to the California Medical Board and check, for example,
more research to do.
Surgical Center, and it comes out and it says, well, at least you have. Once you are authorized by the government, that means you are a higher standard than anybody else.
Okay. That makes a lot of sense. I see, because they can't just throw that around and then have it come back on them if it's low class.
There are doctors that operate out of their offices in small rooms. They are not authorized. And so what happens? They might not have the right equipment. They might not have. They might not have emergency medicines. They might not have access to an emergency situation.
Oh, geez. I'm cringing as you say all of this. I can feel this in my sternum.
So there are doctors that there are small offices and this. So that gives you that's why you shouldn't go to the cheapest place.
Yeah. Stay away from that.
Of course, he's saving a lot of money by doing that.
Up front, not in the long run.
So having a accredited facility is important. It's like you're going to a fair, a health fair, or going to a hospital to be treated.
Okay.
That you might find doctors there, but the hospital you have.
This is where they can do it.
More equipment, better equipment, more equipped, more knowledgeable. They have more personnel. So that's something that you should do.
Absolutely.
And then if you find the right price, with the place that you are happy with, how created the surgery is, the surgical center is, I think that you can make based on those situations and that knowledge, then you can make a smart decision, or at least not an intellectual,
like an informed decision, like narrow it down.
Exactly, informed decision. So rather than just say, right,
exactly. This is the first one. Showed up on Google. I'm going there. Okay, so I think my next question I wanted to ask you, and I think you touched on a lot of it in what you just said, is like, let's say somebody does find somewhere in this happy medium a doctor that they should go to. How, and maybe this is specific for operation or for people, like how might someone prepare for getting ready to go in for a cosmetic procedure? Like, what is there stuff they can do? What actions can they take once they've, picked a doctor and determined on the procedure?
Well, in general, they're going to give you a once you pay a down payment, they should give you the date of the preoperative workup.
Okay.
Which and also the day of the surgery. That preoperative workup should be from the last 3 months, close to the surgery date.
Okay.
The last 3 weeks, I'm sorry.
Okay.
Because most of the laboratory results will only be good for 1 month.
Oh.
So you don't want to do. You don't want to do, if you're going to be operated in September, you don't want to do it in June or July because they're not going to be worth anything.
Yeah, it's going to expire by then. Your situation could be totally different. Okay.
So the preoperative, so they give you that. You know what that is. If you are taking any if you suffer from any disease which are being treated constantly, like hypertension, diabetes, make sure that when you go to the preoperative workup, you take your medicines and you probably even check with your own general practitioner to see how well you are, how good is your sugar, how good is your hypertension.
Yeah, that's such a good point. Okay. Yeah, don't just go into it. Just, make sure to get checked, have all this information going in, being informed.
Yeah. Of course, the day of the preoperative work, we're going to do a workout. We do a physical exam. We do blood work. We know if you're diabetic or if you have high blood pressure. And if that's the case, if they find that you have diabetes, depends on if you've been treated or if it's a new diagnosis. Okay. So if it's a diagnosis, we start treating you for 2-3 weeks until your blood sugar is down.
Oh, until you're okay for the procedure.
The procedure or the blood pressure is down. Or we recommend for her to go back to her general practitioner and have it controlled before the surgery. So just because you have hypertension or diabetes, that doesn't exclude you from having surgery. The important thing is that the day of the surgery, your blood pressure is under control.
I see.
Your blood sugar is under control for the day of the surgery, and maybe 2-3 weeks after that. Make sure that it's very well controlled.
Boy, that sounds
if you're taking keep on taking the medications. Generally, the day of the surgery, you should take your your blood pressure medication. You should not take the diabetics medication. The sugar is because you are fasting. The sugar will be already low.
You're getting ready
so
for
you might not
even
need the. And if you need it, we can provide some things during surgery.
Okay.
If you're taking vitamins, that most people are taking nowadays.
Yeah, I am.
You should stop them about 10 days before the surgery.
Okay.
Because they produce a thinning of the blood, which make you bleed a little more.
I never knew that.
So multivitamins should be stopped about 10 days before the surgery. And also if you're taking aspirin or ibuprofen, also those medications will thin your blood. So you should try to stop those or at least ask your doctor what to do. You can take Tylenol if it's for headaches instead of taking ibuprofen. The day before the surgery, prior to the surgery, try not to gain weight. Some people come for the consultation at one weight, and then because they know that we're gonna do liposuction.
You're gonna do a liposuction, so they just eat a lot before that.
Eat like crazy.
Geez. That
they should try to maintain the weight that they had.
I don't know why I find that so shocking, but I find that very shocking. Okay.
So because they eat, sometimes they come in a month they have gained 15 pounds.
Wow. Okay. I mean, I'm stunned. I mean, it's as if you're gonna be able to work some kind of miracle or something. I mean, wow. Okay.
And the day of the surgery, follow the instructions. Some doctors, like in our case, we ask them to bring a little bandana. To hold their head back. To wash their bodies with antibacterial soap. And things like that. 1 or 2 days. Bring comfortable clothes,
Mm-hmm.
like what is it? Suits that are not done white leggings.
Yeah,
That
yeah.
are very tight.
Yeah, something
Sweater.
loose, so it's more comfortable.
Sweatsuit, we're comfortable.
Mhm.
Bring questions, even you can ask questions even to the end.
Yeah.
Bring pictures of what you look like. I mean, bring pictures of what you want to look like.
Right, right.
Even though we are not going to promise that it's going to, that you're going to look like Angelina Jolie.
Right, yeah. Supermodel. Yeah.
But at least we have an idea what you have in mind.
Yes,
What's
absolutely.
in your mind. And we try to use that information to give you the better results.
Absolutely. Just as you would take a picture too. How many times do someone gets their hair cut? You mentioned that earlier.
Exactly.
Take the same thing, just with you. Yeah.
So that's important.
Mm-hmm.
And just follow the doctor's instructions and ask questions, sign consents, read the consents, ask for copies of the consents if they are in a different language than your own. Find somebody who will read those consents for you. Make sure that you understand, because there are those consents are giving the doctor authorization to do the surgery, but it's also giving the explanation of what the surgery, the complications that could happen.
Right.
And even though most surgeries are very, very safe, because in general, I mean, there are thousands and thousands of surgeries, like liposuction and other types of surgery
daily,
done
I'm sure.
every day.
Yeah.
The serious complications are a very small portion, very small portion. So people are always, so of course, nobody talks about the good surgeries.
Right. The thousands that occurred every day without incident and give people what they want. Yeah.
So just read, inform yourself. I think that's the most important thing. Inform yourself about the surgery, the procedure. Inform yourself about the doctor, about the surgical center where this is going to be operated, and get the information for the preoperative workup and the operative period and the postoperative period. And with that, I think that you are going to be happy and you're going to be content with your results.
Absolutely. I mean, that was a very comprehensive explanation. I mean, I was thinking like, okay, we'll ask about what happens after the surgery. I'm thinking, well, you covered that. In terms, you covered what happened that day. You covered what would happen after it. I am a little curious to ask about. You mentioned a couple times some of the procedures that maybe you offer here that maybe folks can't find in a lot of other places. One that came up that I'm fascinated by the name, HD liposuction. High definition liposuction. I'm hearing that. I'm thinking, okay, I think like a lot of people, I have an idea in my mind as to what liposuction might be. If you could tell us a bit about, what your high definition liposuction is and how it differs and how it could help folks. I'm fascinated to hear that.
Well, first of all, liposuction. Liposuction means, lipo means fat.
Okay, that one I know.
Suction. So liposuction is a procedure that is designed to suck blood, fat out of your body.
Yeah, makes sense.
And in the past, that's what we did. Just pull it out. People were happy to decrease the size of the stomach or the abdominal area.
Oh yes,
they were happy, but they were not really counting on being more pretty or a better image.
I see. It was just about removing the fat. It wasn't about toning.
People were so happy with that.
I see. That was good enough.
They were able to wear jeans and things like that they hadn't done before. So liposuction is a suction of fat.
Okay.
Now liposculpture. That's a different story. That's when you do it with. That's the artistic part of it. Yeah. It's like a sculpture. Now that you're sculpting a woman, you are changing. Enhancing those attributes like the breasts, or the legs or whatever. Yeah. But also you're decreasing or removing the fat so that you have now a waist.
Yeah, the hourglass figure.
And then you have and you can have, for example, enlargement of the buttocks by adding fat. Yeah. So you are really making like a statue of a person. You're making
work of art.
You're making you're changing the person's image and everything. And that depends on, of course, the doctor's
100%
knowledge, the doctor's ability to do it.
Yeah.
and the talent. So it's something that you can learn, but also something that is innate in you.
Certainly.
Not everybody can paint like Picasso.
No. There's not many of that.
So the same thing happens here. Of course, there are different levels of doctors, different abilities and to do the sculptural part.
Yeah.
So I think that's what the artistic part comes when you do liposculpture.
Okay.
Now, there are things that can help doing liposuction, devices that are technology that help perform a liposuction.
Okay.
So there are laser liposuction, laser assisted liposuction. Laser is a light that burns or so helps to burn to destroy the fat.
Okay.
So that's laser liposuction, which is not used very much.
Okay.
There is also ultrasound assisted liposuction.
Oh.
Which is more benign, is less destructive, and it helps you a lot in doing removing the fat, because you can remove or liquefy fat from a distance, so you can do a better contour and better job at sculpting with the laser or the ultrasound assisted liposuction.
Okay.
There are so that's what else do we have? There is also liposuction that treats. Most liposuction don't treat the skin that much.
Okay. I see. It's just about getting the fat out of there. Okay.
But even though the liposuction itself is not a procedure in which you are, which makes it's not a procedure that is performed to retract the skin, like when the patient has saggy skin or stretch marks.
Yeah.
It's not a procedure that is going to do that, or is devised to do that, or designed to do that.
Oh, I see. It's just
but
one
it
thing.
Does.
Okay.
But liposuction, because of the trauma that you produce under the skin, in the subcutaneous space, the body reacts, producing inflammation and producing collagen, which makes the skin retract.
Okay.
That's a secondary effect.
Okay.
That's a good effect that will help almost anybody.
I bet.
Liposuction alone. Now there are other devices that help you really, that are made or were designed to produce skin retraction.
Okay.
And that is they're out there, that which makes makes the results be really very, very good, because they are retracting, they're attaching the skin to the muscle, and it makes a big difference.
Okay.
And they are really actually designed to do that, to retract the skin and produce a better contour.
Yeah.
And also somehow it treats the skin a little better. It looks better with the skin itself looks better.
Wow.
So that's something that you can do. And that is that procedure is called J plasma.
Okay, I was going to ask you about that in a second. Yeah.
And it's also called Renuvion, which is the company that produces it, called Renuvion. It's very very common. There's another procedure. It's called skin body tight, which also produces skin retraction. So skin retraction is very important. So we spoke about liposuction, liposculpture, liposuction assisted with ultrasound, liposuction assisted by laser,
J plasma,
skin retraction, J plasma. We can talk about in another occasion each one individually. And I think that all this technology has changed the game, because before we just were waiting for. People were complaining that I like my results, but my skin's still saggy.
I fix that. Yeah.
I still what am I going to do with this? Then you can only offer a tummy tuck cutting it now, but people don't like scars.
Yeah.
So these avoid scars, visible scars, and and also gives you good result, good retraction. It's not for everybody, but then we can talk about it.
So that's amazing, all those different procedures and all that kind of stuff. Now, I got one thing I was kind of wondering is I can imagine a lot of folks are sitting at home watching this and thinking, okay, that all sounds great. How might I know, or how might a person know if they're a good candidate for any of these procedures you've talked about today, doctor?
Well, I think that it comes to the happy medium again.
Okay, that makes sense.
For example, I don't know, most people know what BMI is, body mass index.
Body mass index. Mm-hmm.
So patients that are too skinny, sometimes they don't have great results.
Oh,
because they don't have any fat.
I see. There's not as much to work with in the sculpture, like you said.
So however, there are good results depending on how much the body type.
Yeah.
But because we are not removing that much, so it's difficult to use the fat for other things.
Yeah.
So those people that in the very low end get good results, but not as good as other people.
Mm-hmm. Okay.
People in the big end where they have the BMIs of
the higher BMI.
34, 35, which is in the obesity category.
Yeah.
Those are not just because the amount of fat that is taken out sometimes has to be done in 2 or 3 stages. To be safe.
Mm-hmm. Mm-hmm.
The more weight, the less safe it is.
Right. That makes sense.
Also, about age.
Mm-hmm.
Of course, it's different in a person who is 30 years old than a person who is 60 years old.
Right. Oh, yeah.
So age is also very important. So the good candidate is a person who is not that old.
Yeah.
He's not really, really young.
Mm-hmm.
But a person who is like 30 years old, from like 25 to 45, those are the ideal candidates.
Okay. Makes sense.
Because they will have excellent results, almost zero complications, and they're going to be very, very happy with the results.
Gotcha.
Now, as you get older, you get into the 50s, 60s, the skin doesn't retract as well. Just because the skin itself has lost a lot of the elements, elasticity and flexibility, and the vascularity is also decreased, so the healing process is delayed. So all the things doesn't make a candidate, a 60-year-old candidate, a very good candidate.
Gotcha.
Persons who have problems, medical problems, like persons with asthma, COPD, respiratory problems, persons who have uncontrolled diabetes, uncontrolled hypertension, and those are all patients that are not very good candidates.
Okay.
Especially, for example, a diabetic patient that has not had good control, has poor healing, more chances of infection. The skin doesn't retract as good. So those patients who have problems, medical problems, they should be under control.
That makes sense.
Very well controlled before the surgery.
Okay.
And also it's important the patient's mental well-being.
Okay.
If a patient that for example, usually we find patients that are getting into a divorce, they are depressed. So the husband is leaving, and they want to change everything. They want to retain the husband.
I see. Start all over.
So I'm going to do big boobs and
jeez, it's
big
reactionary.
And sometimes it doesn't work. Most of the time, the husband still leaves, even if the patient did the surgery, because most problems does not get fixed with having big boobs and butts and
it's not
house.
Therapy.
No, there's other things that happen.
Extenuating circumstances.
And money.
Right. Counts as one of those. Money's pretty big circumstance, Dr. Raj.
So things like that. So it's important that the patient comes to the surgery in a good state of mind.
Yes. Wow, that makes sense.
Thinking of permanent results.
Yeah.
Not doing it because the sister did it, or because the husband is leaving, or because she's gotten too old, or something like that. Just because she wants to be better. She wants to improve her image. She wants to improve herself.
Right.
And she and that has to be, all these decisions have to be done in the right frame of mind. So it's important that mentally that patient is in a good, calm state,
right,
to have better results.
That makes so much sense. I mean, that even gets back to what you talked about making an informed decision, the best decision for you. You can't do that if you haven't taken care of the mental aspect of it as well beforehand.
Yeah. Also young. For example, most people, it's not recommended to have cosmetic or plastic surgery before the age of 21.
Okay. That makes sense too.
Sometimes but women want to have it at 18, just before they go to college, you want to have breast augmentation.
I see.
Well, I think that maybe in that case, psychological evaluation should be should be able to address any problem. But in general, after 21 is when people can make the right decision.
Okay.
Okay.
No, that makes a lot of sense. That's great. I mean, that's you explained it so well, Doctor. I mean, I know I say this every time we do one of these, but I learned so much. I always say I learned. I did learn so much. I mean, that was genuinely fascinating. I could talk to you all day. I mean, is there anything else that I didn't ask you that you'd like to cover? I mean, there was so much, Doctor. This was
there's so much that we can still talk about. But let me just say one more thing.
Please, absolutely.
People say. What do I need, a liposuction or a tummy tuck?
Okay, yeah, that's a great question.
My first question is, do you have stretch marks? If they say yes, how important are you with the stretch marks? They're not important. I just I don't take my clothes off in front of anybody.
I see.
I go to the beach and I wear a one-piece swimming suit. So I don't care about them. If that's the case, and she is a good candidate for liposuction, then I will offer the option of a liposuction or a tummy tuck.
Okay. You're often want to
because they can have either or. But liposuction is a good option. If she is very concerned about stretch marks and she doesn't like them and she hates them, then tummy tuck is the only way to go. It's the only way that is going to address that problem.
Liposuction won't, is what you're saying.
Liposuction won't address the stretch marks. If the patient has a stomach that is too saggy, that is hanging too much, also liposuction will not address that problem. So a tummy tuck is also a good option for that. What's the difference at the results? Well, the results both very good. The difference when you do liposuction only, you might not have any visible scars or hidden, the incisions are hidden. In the tummy tuck, you might have a scar at the bottom of the abdomen, the lower end of the abdomen, and that scar could be a good scar, could be a bad scar, depending on how well you. All those things happen, then a liposuction is a very good option and will give you very good results.
That's great. Well, I mean, we're going to flash it up here on the screen, but how can folks get in contact with you if they want to learn more, if they want to talk to you, the consultation, how all that works? How can they reach you?
Well, my office and my surgical center are located in near Venice Beach, California, in the west side of Los Angeles, on Venice Boulevard, and I'm very centrally located, like we said before. And so they can call the office. The office phone number is 310-391-7143.
Okay.
And we are here to help you provide the best service and to make you be the best version of yourself so that you can love yourself more and that you can love also everybody else.
That is a perfect sentiment to end this on. I couldn't say that. Thank you for saying that. That was great. Again, I could spend all day talking to you. This was just incredible. This was great.
Thank you so much.
Thank you, Doctor. Thank you. Thank you to Dr. Rojas. On behalf of Website Depot, my name is Greg Benevent. Take it easy. Have a good night.
Amazing.
Wow.
Bueno.
Okay.